Thank you to the Scientific Committee for the opportunity to present our work today entitled, Is Nocturia in Women Driven by Urine Storage or Bladder Volume? As you'll be well aware, nocturnal polyuria has been found to exist in up to 80% of people with nocturia. However, we also know that the symptom of nocturia is part of the overactive bladder presentation. And furthermore, that urinary frequency and urgency are commonly seen with hormone depletion. What we don't understand is the effect of hormone status on nocturia per se. The Tango Causality Nocturia screening tool identifies coexisting causal factors for nocturia. It does not have a hormone-related domain. The aim of this study was to investigate nocturnal bladder parameters in women peri- and postmenopausal and to describe the impact of these hormone-related factors on nocturia. Furthermore, we wish to determine whether hormone-specific items should in fact be added to the Tango Causality Nocturia screening tool. This was a multi-sectional cross-center study of women approaching the menopause or after who were attending 3 tertiary public continence clinics. We excluded conditions that artificially affected the diuresis rate or bladder storage. We used the ICS definition of once a night or more for nocturia, but also reported the clinically relevant definition where bothersome nocturia was twice a night or more. We used the standard current definition of nocturnal polyuria being a third or more of 24-hour urine. In the study, we collected 3-day, 2-night bladder diaries. We devised a hormone status and intervention questionnaire from a rapid review of risk factors for impact on bladder function. And we used the causality screening tool for nocturia. In total, there were 158 women who participated in the study from 3 sites with a mean of 64 years. As you can see, the vast majority of them were beyond the menopause. A third of them each had hormonal symptoms in the daytime and at nighttime. And 40% of women self-reported a prolapse. Nocturia is reported in 2 ways, both of which had high agreement with each other and showed that at least 85% of the cohort got up at some time during the night. And 49% woke up twice a night or more to void. So in the women that woke up twice a night or more and had bothersome nocturia, we noted that their urine production was higher and their bladder storage was lower. So their urine production first. 78% of them had nocturia, which we might have expected. Nearly half had an increased nighttime diuresis. And the change in nocturnal urine volume was 167 mils for women who got up twice a night versus any less. And their nocturia index was above 2 in women who got up at any time during the night, but significantly higher in women who got up twice or more. In terms of the bladder storage, it was reduced in women who got up twice a night or more, 268 compared to 360. All these changes were significant. There was reduced diurnal bladder capacity, 200 mils versus 300 mils. And the nocturia bladder capacity index, which is indicative of OAB, was 1.25 for women who got up twice a night and significantly less for other women. The nocturia severity was unaffected by the phytoestrogen foods women ate, by their self-perceived body habitus, the presence of urogenital prolapse, and any loss of sexual interest or vaginal dryness. Bladder diary values were unchanged by any of the interventions addressing hormone events, such as probiotics, estrogen replacement, non-steroidal anti-inflammatories. When we performed some regression models to try and understand these findings, nocturia severity was predicted by age, but also by vitamin D intake. So 133% increase in the likelihood of bothersome nocturia for women taking vitamin D. Nighttime sweating also had a double the odds ratio of nocturia severity being higher, which approached significance. When we use the bladder diary variable of nocturia severity, Then daytime flushes increased the risk for bothersome nocturia, but regular exercise was protective of the risk. Looking at the nocturnal bladder capacity index, which you remember would be suggestive of overactive bladder if it was high, this showed a 2.8 odds ratio for daytime hormone changes. And if we then look at the regression model for nocturnal urine volume, high nocturnal urine volume was significantly predicted by these 4 factors: hot flushes during the day, vitamin D supplementation, and age, and was significantly protected by the standard prescription of 150 minutes of moderate exercise per week. Nocturnal polyuria was significantly predicted by age and protected by exercise. And of interest, pelvic hormone prolapse was significantly associated with the increased nocturnal urine volume. So in summary, women around the menopause or shortly after have clinically relevant nocturia of a mixed origin. It's driven by both an increase in nocturnal urine volume and diuresis rate and a reduced maximum voided volume during day and night. Future work will need to elucidate the mechanisms of vitamin D on increased nocturnal urine volume, and also consider the translation of these 150 minutes of exercise and behavioural strategies that reduce nocturnal urine volume to the standard care which we currently all espouse. Furthermore, the Tango causality screening tool could be modified to include the item daytime flushes in the cardiometabolic domain. Thank you for your attention.